where everything this president does seems to empower those who are threatening world peace.
It's not, like you said, it's not just the Cuban situation, although this is an important one. We're seeing this time and time again around the world. We're seeing North Korea sell weapons to Venezuela. Venezuela has threatened to use these, not that they will necessarily, but threatened to use them against the United States. The first sale of missiles could reach from Venezuela to Atlanta, Georgia. The second set of missiles that they're selling is a little bit longer range. They could be launched from the ground in Venezuela and reach as far north as New York City. Now, you cannot tell me that this is not hurtful to the United States' security position.
And it doesn't even have to be ICBMs. If we're talking about Russian subs in Cuba, Tomahawk-type missiles, similar to the United States Tomahawk missiles, could be used against the American southern coastline. There would be practically no radar warning, no time to respond whatsoever. That's a real imminent threat. And we are seeing a pattern of bringing together anti-American nations with Russian, Chinese, and Iranian weapons in a coordinated pattern against the country. Now, according to a Bolivian diplomatic document reviewed by the New York Analysis of Policy and Government, there's an attempt to develop a number of cooperative economic initiatives and a new joint military doctrine aimed against the United States by countries like Cuba, Nicaragua, and Venezuela, again, aided by the Russians, the Chinese, and the Iranians.
Well, we see our president talking about how, he's really not that proud of the United States. We're just like any other country. It seems that he's almost, I can't even bear to say it, but it seems as if he's actually trying to negotiate away our advantages and just literally doing things that are hurting the country. So I just fully can't understand what's going on.
Yeah.
I just, you want to, I want to say that I'm just not seeing something, Frank, that I'm really misunderstanding. And that it really is going to get much better, but it just isn't.
Well, let's talk about something domestically. We're seeing the first real full year of Obamacare really taking root. And a lot of the fears that the people had about certain parts of Obamacare are really coming true. A lot of people who are covered by Obamacare are realizing that it's a lot more expensive than it was advertised to be, and it covers a lot less. We spoke with the New York Analysis of Policy and Government, spoke with some folks who are medical coders, the people who get the bills that you present to your doctor, and they present it to the insurance company.
So all the technical
stuff. And they're finding that people with Obamacare are being denied very basic medical practices, which had always been covered in the past. So that's becoming a real problem. One of the other key fears that people had was something called the IPAP, the Independent Patient Advisory Board. And this is supposed to be a review organization that takes a look at the expenditures, whether it's so-called cost-effective to provide a certain type of medical care to a patient. Mostly, the people affected by the IPAP, the Independent Patient Advisory Board, tend to be older folks. And this horrible, horrible equation of, well, you're perhaps 70 years old, you're a male with prostate cancer. We don't think it's worth the taxpayers' dollars to give you the surgery or the medical treatment you need because you're not a productive citizen anymore. You're probably only going to live maybe another 6 or 7 years anyway, so why should we pay for your medical care? Just drop dead and save everyone a lot of money. Now, the Obama administration and supporters of Obamacare swore on a stack of whatever they believe in, whether it's Bibles or not, that this was not going to be the case. But more and more we're hearing it is indeed the case.
I just find it outrageous that people in the government, the Obama administration, could actually say that it is a quantitative measure, not the quality of life. When someone says, my mother is going to be 89 years old in September, and she is as alert as anybody who is 40 or 50 years old or even 30 years old. She knows what's going on. She's active, this type of thing. Her quality of life is important to me. I don't think because she's going to be 89 years old, she should be denied care. Now, we know there's two populations, the very young and the very old, that are in need of more care, as well as those who are very, very ill from, whether it's a cancer or something like that. I think that there's lots of possibilities of what we could do to ensure that these groups are cared for without destroying the medical system in the United States. I mean, there's just so many things that are wrong with Obamacare that, the list of them would be almost as long as Obamacare bill itself.
And the issue here, too, is the fact that, as Nancy Pelosi said while she was Speaker of the House and this was being passed, we have to pass the bill to see what's in it. There's another issue that's arising out of all this. This is a huge legislative initiative, and it really occurred in secret outside of the view of most Americans. We didn't have a chance to review this legislation, and neither, by the way, did a lot of legislators. This was a top-down piece of legislation. The legislators in Congress were basically handed a fait accompli. I believe there were several thousand pages, and they were told, well, this is it, vote it up or down. And, of course, at that time, the Congress was 100% controlled by the Democrats, both the Senate and the House of Representatives, and they did the party line. They voted it up.
Now, Frank, did you see when, after this bill was passed, I forget which congressman it was, but he actually went through and read through the bill, and they timed the reading of it. And what he showed was there was actually no way, even just a straight-through reading, now that does not include the wherefores and the who-tos or whatever, about looking up other things it relates to, or an analysis of it, that literally that you could not get through this bill. So now with something that is as strong as 18% of our economy, what was going on when 18% of the economy is at stake and nobody has had a chance to literally read or analyze this bill?
Yeah, Betsy McCoy Ross has become something of an expert on this bill, and I've been at a number of events with her where she carries around this enormous, yard-long stack, which represents basically the bill. It's indecipherable. David Hogbird, Dr. David Hogbird, is a healthcare policy analyst for the National Center for Public Policy Research. Previously, he was a Washington correspondent for Investors Business Daily, specializing in his coverage of healthcare and medical care. Dr. Hogbird, thank you for being with us today.
Thanks for having me, and feel free to call me David.
Okay, thank you, Doctor.
David, I get so upset about Obamacare that, I might have to use it or else buy stock in the Tums Company. I mean, it is just unbelievable what, we keep finding out more and more about what this bill is actually doing, not only to the economy, but to the health of the American people. We're hearing more and more cases where people that should be getting care are not getting the quality of care that they had in the past. Do you see anything with the degradation of care in America, or do you think that it's going to get straightened out?
Well, at the rate it's going, no, I really doubt that it's going to get straightened out, unless, of course, this bill is repealed and replaced with something that moves us toward free markets, which I do think we're going to have a possible opportunity to do if we get someone new in the White House in 2017. But that said, look, what we've seen with Obamacare and the individual market for health insurance, a market that was actually, functioned relatively well prior to Obamacare. We've now seen big increases in deductibles and out-of-pocket costs. With that, higher premiums than what was available in the individual market prior to Obamacare, and along with that, what's now known as a skinnier network. That is a much smaller network of doctors and hospitals that people who have an insurance plan have access to, and that's largely due to all the regulations that are required to that insurers have to meet in order to sell on the Obamacare exchanges, whether it's things like community rating, guaranteed issue, the 10 essential benefit, the 10 quote unquote. Actually, I guess it's 8 essential benefit categories that they have to cover. All of that costs, and the only way to meet those costs is to and still have a policy that's affordable is to up the out-of-pocket costs and to reduce the doctor and hospital networks.
In researching the Obamacare bill, the New York Analysis of Policy and Government found or spoke to a number of medical coders, medical billers, and found that a lot of routine procedures, which had always been covered in the past by prior insurance policies, have been rejected for people who have Obamacare. How prevalent is that?
I don't know. That's a good question, and I have not really researched it.
Well, when we first heard that we were going to get Obamacare, we heard that things would be better, that everybody would be covered in America. We heard all these great promises. It seems to me that we have an awful lot of people who are not covered and that the quality of care has gone down. Are you finding that there are a lot of Americans that are still not covered properly?
Well, there is evidence that, especially from the Gallup poll, that the number of people who were uninsured has dropped some, somewhere from around 15% to maybe now under 12% are still uninsured. But a lot of that has been due to the expansion of Medicaid, which is not exactly what you would call great insurance. There's even research that suggests that you might be better off being uninsured rather than have Medicaid. And there was certainly the big experiment in Oregon just a few years ago that was studied very extensively and could not find any real improvements, health improvements with among people who had joined the Medicaid program versus those that did not. You've seen a drop of in the number of people who are uninsured, but they're largely getting insurance that is I would say inadequate.
So aren't we seeing people that wanted to keep their health plan but now they can't? And in some states, we're hearing here that 1 to 2, maybe 3 insurers in a state. To me, that seems like it's changed from a competitive system to an oligopoly in medical care.
Certainly you have, there's been research done by the Heritage Foundation has found that there are fewer insurers on the exchanges than there were in most states' individuals' markets, prior to Obamacare. I also have, I've done some research that shows that there were certainly more policies available in the individual market versus what has been on versus what is available on the Obamacare exchanges. So, in terms of choice, there certainly seems to be less of it on the Obamacare exchanges. Which is not surprising, that's what happens when, government, comes in and imposes regulations and increase costs. What you're going to see is, the number of, products that you have access to decline because, it becomes more difficult to offer many products and at the same time meet the new costs that government is imposing. As for losing insurance, that was a big deal back in late 2013 and 2014, somewhere between 4 to maybe up to 6 million people lost their policies, who had policies through the individual market, lost them because they no longer met the Obamacare standards. And this was despite, President Obama's constant promise that if you like your plan, you can keep your plan. What he never said, though, was that, you liked your plan, you can keep your plan. The